Hey guys, welcome back. It's a new day, so it's time for a new topic. So, how many of you are familiar with one of these? Well, in today's video, I wanted to talk about medication. That was just an empty medication bottle, just to let you know. So, yes, medication for mental illness. Very, very common, but still carries a huge stigma despite how frequent mental illness is nowadays. So, why don't we start spreading a little information about that and just kind of clear the air a little bit, make that a little easier. There are a lot of reasons why people take medications for mental illness. Some of the more common ones you may have heard of would be antidepressants in someone who's depressed, possibly anxiety medication for someone who has anxiety, mood stabilizers for things like bipolar disorder, depression even too sometimes. Then there's also antipsychotics, which can be not only just in people's various types of, like, for example, bipolar disorder, but also schizophrenia. So there are a lot of different types of medications for different things. One person may be on one medication, another may not be on any medications at all. One person may used to have been on medication, but now isn't because they don't need them anymore. Some people are even on several medications. And there's really no right or wrong answer because this depends on the person. Some people can find the right medication right away and start feeling better pretty quickly, and others don't. Some have to try several medications. Some will get on a medication after several weeks, they still don't feel any better. So there are a lot of different factors that can play a part in your treatment when it comes to medication. Now, therapy is another notable thing that people also get with mental illness that's very helpful, but sometimes therapy alone isn't enough for people and they have to be on medications too. So when you're on medication, there are a lot of very important things to keep in mind. Many medications, in order to be sure you're on, a good dose and in the therapeutic range, they may require you to get your blood taken every so often to ensure that it's effective and that you're not reaching toxic levels or anything. So if you're on a medication that requires you to do that, do keep up with that. It's very important. You don't, especially with something like lithium, you really don't want to skip that. You don't want to treat one problem with another one, as I like to say. And if you have to follow up with your doctor every so often, again, really follow up with old doc. He's very important. And with medications, communicating with your doctor is already very essential as part of just the patient-provider relationship, but especially if you're on medication. Your doctor wants to be sure that you're getting the right medication. They want your best interest. They want you to be healthy. And if you're not truthful about the things in your life, like any lifestyle choices you make or how many medications you're on or any other important questions they ask you, that can have very detrimental consequences. So even though they ask you questions that may seem a little funny, or you may not see the significance of it, or maybe you're even a little afraid to tell them the truth because maybe you kind of have a phobia with going to the doctor or anything like that, really push yourself to be as honest as you can with your doctor because you don't want it to affect your course of treatment with withholding very vital information. Because there are a lot of things like lifestyle factors that people don't think about that could affect your course of treatment, not only with your medications being in therapeutic levels, but just other things. Like when people see their doctor before surgery, if they ask them if the person smokes marijuana or drinks or anything like that, they think to just keep that to themselves because, oh, well, that's not important. Well, if it can cause you to wake up in the middle of your surgery because the amount of anesthesia they gave you wasn't right, okay, so that's a really extreme situation, but there's a reason why being honest with people is so important. And certain lifestyle factors like that, or smoking or drinking, can affect medications. They can have interactions, especially with alcohol. There are some medications that your doctor may not want you to drink alcohol at all, or if you do, very, very limited, because they can have some pretty serious side effects if they mix with alcohol, and then you have to worry about things like your liver function and other parts of you. So if there are things like that if you really maybe consume a decent amount of alcohol or you really don't want to quit smoking, again, really talk to your doctor about it. And if the one they put you on is more likely to interact, perhaps they can put you on one that won't interact so much, or maybe they can work something out to see if they can get you feeling better without causing anything else bad to happen in between with the medication or interactions. So Talk to your doctor about that stuff and be honest. Very important. So yeah, with medications, there's just little room for messing around with that because you really want to get feeling better. It does take time for medications to kick in, some more so than others. It's not uncommon to take a couple weeks, maybe even several weeks for things to start working. And for somebody who really, really wants to feel better right away, well, that can feel like quite a bit of time, especially if you feel like you've been hanging on by a thread up until now. So another very important thing to communicate to your doctor with if you are really not feeling any better. Because if it's been like a week, it can take time for things to kick in, but then if it's been several weeks or even a couple months and you're still not feeling better, it's okay to go into your doctor and say, like, I'm still just really having a hard time. It's been a couple months. Is there anything else we can do? Is this supposed to take this long? Like, what are my options? And sometimes they may have to switch you to something else because the first thing you try may not be the one that works for you. You really have no way of knowing if a medication or even therapy is going to work for somebody. So until they actually get put on it, that's kind of when you kind of figure out, like, okay, this isn't going to work. Or maybe you're starting to feel better. But like a lot of antidepressants have weight gain. And for some people, especially if they have other medical issues, weight gain can be quite a problem. So although, okay, this medication works, but if those side effects are really a lot, again, it could be time to look for an alternative, whether it be another medication or just something else in general. And it's a very, very aggravating thing to go through that a lot of people who don't take medication for mental illness really don't understand. So expressing that to people why you take the medication in the first place and how aggravating some side effects can really be. And those are another really important thing to mention to your doctor, is that if you're experiencing a lot of side effects, like if you're having trouble sleeping or if it's impairing, like I said, the weight gain, or some people, it can affect their personal life, like their libido. And although as silly as that may sound, that is important for people, like if they're married or dating or just in general, because that can be pretty embarrassing, especially for men. So, even things like that are very embarrassing are very essential to tell your doctor if something's not working for you. And if you're somebody who's still in the process of trying to find the right medication or even therapy to figure out what works for you, and you find yourself just really getting aggravated, really frustrated because it's something that's been going on for a while and you still feel like you're hitting one dead end after the next, try your best to be as patient as you can, knowing that, nothing's going to start working in a couple hours or even a day or so. But again, if it's been a long period of time and you've tried your best to be patient, bite your tongue, and not just stopping anything, then you're allowed to explain to your doctor why you're frustrated and ask about anything else that may work better. And as hard as it is to keep waiting for things to get better, don't discontinue your medication without your doctor's approval first, especially if you've been on it a very long time, because some people can have allergies and have to stop things at some point, but some of these medications, they can have very severe withdrawal if you've been on them for years, especially ones like Topamax or Seroquel. And I have friends that have had that stuff happen, and let me tell you something, it is a nightmare. You do not want to stop your medication and start shaking horribly and feeling sick and not being able to sleep. And I apologize if that's a bit frightening, but it's a very, very real thing. Like, if you stop a medication, immediately you can get very sick and you can even end up in the hospital. So as a matter of caution, that's why I wanted to mention that part as well. It's important that people need to know about. And in addition to medication having a huge stigma, your body becoming dependent on a medication, and just like how some people are addicted to drugs, is very, very controversial. But it's a very, very important thing to talk about and to keep an eye on, because you may not realize that kind of thing until you start having really severe side effects of things like that. So, yeah, this is a lot of information to take in. But if you're having a hard time, just hang in there and just keep trying, and you will find something that works. Be very honest with your doctor, your psychiatrist, your therapist, and give things some time, and things will get better. Until then, take everything one day at a time. And keep positive, okay? Have a great day. See ya.